Pleasure this afternoon to be your facilitator for the Empowering the Older Person workshop. This workshop is sponsored by the Ministry of Community Affairs. Is anybody from the Ministry of Community Affairs in the audience? Anyway, there we go. Can we have a big hand of applause for Ministry of Community Affairs? Thank you very much. So join me this afternoon. I have a team of panelists, and these are really the experts in the room this afternoon. These are the individuals who have had some sort of interaction with older persons, either, in their day-to-day work or otherwise in the community. And they're going to share with you little nuggets of their experience. This is meant to be a very interactive workshop. This is an opportunity for us to hear from the experts, but also it's an opportunity for us to hear from you. We want you to give us your thoughts, give us questions, ask the panel questions, anything that you think is relevant to what you do or questions that you have. We don't say that we're going to have all the answers, but I know that there are some older persons in the audience this afternoon that will help answer some of those questions. Okay? There we go, Mrs. Soto. I know you're there to help me out this afternoon. So this is 2 hours, so we'll be here for the next 2 hours. If you want a coffee or water, there's coffee and water that is next door in the breakout room, and you can just zip out and help yourself to something and come back in. We're not going to have a formal coffee break this afternoon, okay? Good. So to start you off, I'm just going to throw out some slides that's just going to talk about some of the data that we have on older persons, some of the challenges, and then I will introduce our experts one at a time. So I have with me here this afternoon Felicia Robinson. She's a director of the Department of Children and Family Services. Miss Felicia, can you just give them a little wave? Thank you very much. And sitting next to her is Mrs. Felicia McLean. She's a Director of Operations and Nursing at Cayman Hospice Care. Thank you, Felicia. Pastor Alison Ebanks. He is the Senior Pastor at Church of God Chapel, Georgetown. Thank you very much, Pastor Alison. And we have Dr. Wilmoth Shillingford, better known as Dr. Andy Shillingford. He's a General Practitioner at the Health Services Authority. Thank you, Dr. Shillingford. And we also have Ms. Shimon Sheehan. She's a nutritionist at the Health Services Authority. Thank you, Simone. And here next to me we have Mrs. Linda Mitchell, who's the manager of the Pines Retirement Center. Thank you very much. Okay, so we're going to be talking about issues affecting the lives of older persons here this afternoon. And what do we do? How are we doing at empowering older persons? And what do we still have to do? What are the gaps out there that we have to work on? So many of you, I know, are looking for ways to see how we can all stay younger forever. Some of you may have some of the tips and tricks already, because many of you, I know, don't really show your age. But unfortunately, that is something, it is the natural progression of life, but you're not alone. There are others around the world, around the many ages, who have also been looking for, how can I stay younger? What can I do to stave off becoming old, or looking old, or feeling old, right? So the definition of older persons is usually 65 years or older. And that's usually around the time that persons are starting to collect their pension payments, right? And at the same time, even though 65 is by definition the constitutional age for being older, we know that there's young old, and then there's older old. And those young olds are still very active and still very vivacious and still not really showing their age. And then you have the older old, that are those persons that are starting to have some of those life challenges and illnesses, and are not being as mobile as they once were. And those are the ones that are perhaps having a few more challenges that now require assistance. And we want to make sure sure that we talk about ways that we can empower that older person for as long as possible. Because as we heard in the previous presentations, with empowerment comes engagement. With engagement comes persons who are taking more ownership for their health and are actually doing better. There are better outcomes when persons take the ownership for their own health. So older persons in the Cayman Islands is addressed in the Bill of Rights, and it identifies the fundamental human rights of all persons, including those over the age of 60. And recently, in 2016, Cabinet actually approved the Cayman Islands Older Persons Policy. And there may be some representatives from the Older Persons Council here in our audience this afternoon. If there are, can you just please give us a little wave? Thank you very much for joining us. Wonderful. We're very, very happy to have you all here. However, older persons are not specifically recognized in our Constitutional Order of 2009, and I'm sure that this is something that the Council of Older Persons are addressing. The fact that, you know, unlike those rights and protections that are afforded to children, there are no built-in rights and protections that are actually in our Cayman Islands Constitution, and that's something I know that is being talked about and will hopefully be addressed, because, you know, with getting older comes a lot of vulnerabilities, and we need to make sure that we have those protections built in. So, there are populations that are growing older all over the world, and as you can see, in 2019, so if you look at the dark blue there, that's countries in the world where 30% or more have persons that are 60 years and older. So that's really showing the concentration of older persons all over the globe. And as you can see, moving into 2050, then that dark blue color, that royal blue color actually increases. So we are having an aging population, and that's no secret. You know, you can just look around in our own community. You can see that there's more and more older persons because we're taking care of ourselves better, and therefore, thankfully, we're being given longer years on this earth. So in the Cayman Islands, as you can see, that number as well is increasing, right? Because what we have is a growing number of older persons. That's data there from 1970 to 2017. But a little bit more interestingly is the next picture. As you can see, that first group there is 0 to 24. Okay, so just look at it visually. You see there's just a smaller number, and that's gradually growing, right? The next one to it is 25 to 49. You see that column is growing a lot higher, a lot faster, right? So what that's actually telling us, that right now we don't have the great number of older persons, but in years to come, as in 2050, we too will have a significant portion of our society that's going to be older person. And therefore, we as a community, we as the Cayman Islands need to prepare services and resources for our older persons, right? So that's the reason why this is such an essential topic here this afternoon, and we're excited about getting feedback from you all as to what's out there that you think is working. What do you think you need in order to help you be more empowered and live a more meaningful life? Okay, and this again just signifies the importance of the earlier chart. You can just look across, and let me see if I can get my pointer there. 0 to 24, you can see that that number is gradually decreasing, right? 25% now. But look at that second number, that age group, 25 to 49. Look, it's up to 54%. So this is the age group, that 25 to 49. Today is going to be significantly higher in years to come. So the concerns for an aging population must be of national importance. If we're going to have a great number of our population that's going to be older persons in 10, 15, 20 years, we need to be concerned about it now. We need to start to put those resources in place, because we're going to have a demographic transformation in a few years' time. So what are the issues that impact the older persons? There are many issues, positive as well as some that are negative. And I've just thrown some of those out there, but you're going to hear more about those from the panel as we talk this afternoon. Physical, there's the obvious challenges, right? You know, we have pains in parts of our bodies that we never knew existed, right? The nutrition requirements change. No longer can you eat everything all hours of the day and night, right? You know, there comes a time in the evening that perhaps, you know, some of those oily foods or some of those foods that are more difficult to digest may be a little bit challenging and uncomfortable for us. So mobility challenges are there. We're not able to, you know, to move around as swiftly as before. And from time to time, there are things, you know, you have to get a doctor's certificate in order to renew your driver's license. And eventually, you know, we have to accept the fact that, you know, we're not going to be able to drive until we're, you know, 100 and something, right? So we need to put in place a plan as to how we're going to get around, make sure that that is still possible. Technological advancement and associate challenges for the older person. We talked a lot about technological advancements and how it can benefit the patient on a whole, how it can keep you more informed and empowered. Well, you know what? Those older persons that are in our community today didn't grow up with smartphones and computers in their hands, right? So how are we going to allow our older persons to embrace that same technology? How are we going to make sure that they catch on with those advancements? There's growing lifestyle-related illnesses, and with more education, hopefully we will see a reduction in lifestyle-related illnesses such as diabetes and hypertension and such like. Advanced illnesses and end of life matters. You know, we talk about health and wellness, we talk about living, we talk about what we can do in order to stay healthier, but it's very difficult to start talking about end of life issues. Even in our own families, it's very difficult to start talking about when persons are going to be leaving us. And therefore, when it comes time when our older persons are really ill, then it's very difficult to have that conversation. But if we have that conversation now, while everything is fine, when it comes time when your mother, your grandmother, or your father are at that place, you know what their wishes are, so it's a little bit easier. So I know the Ministry of Health has been doing a lot of education in order to expose the bill, where we talk about, you know, a living will and making sure you make plans and make your wishes known for end-of-life care. There are social issues. Your family start dying, your friends. When you start seeing your friends the same age of you dying, then your social circle kind of narrows, your social circle gets smaller, and that has an impact. Your children are all grown up and they've all moved to other parts of the world, and you know, you're left alone, and you don't have the same social interactions that you did have. So our older persons suffer from loneliness, and we want to talk this evening about what some of our older persons can do in order to try to combat that issue. Loss of societal status. You're retired. You're no longer, you know, in those social circles where you're making decisions and people know you. When you're retired, sometimes, you know, the younger persons that are coming up don't even recognize who you are, what place you used to serve before. Financial security, the pension, those pension benefits, it becomes a little bit harder to stretch them to meet the financial demands of cost of living. The increasing costs of health care, obviously with more illness is going to come a higher cost of health care, and unless you have a good insurance plan, then it's more challenging in order to be able to meet your health care needs with the funds that you have coming in. And unfortunately, we also see abuse, financial abuse by family members. You know, they're taking advantage of their older persons. They're using their property to get mortgages, and then they default on the mortgages and they lose the property. Those are things that we do still see in our community, unfortunately, and we need to be mindful of that. And that's one of the things that, you know, we have to have legislation built in and around to be able to protect our older persons in cases such as that. Family and societal values. You know, unfortunately, we're seeing a bit of a trend from our community where that core family is not as significant as before. So older persons do have to spend a lot of time by themselves. You know, we see a number of older persons in the hospital and they hardly ever have visitors. So, you know, that is something that is a challenge that we need to help them with. Infrastructure. For those older persons that are still driving, you know, as we expand roads and we put in place more roundabouts and overpasses and everything, it becomes more difficult for older persons to navigate the roads. I know I have an uncle that doesn't want to travel on certain parts of West Bay Road anymore because it becomes a challenge, right? So these things, we're doing it to improve our community. We don't realize how it's impacting our older persons. And perceptions of the older person, you know, unfortunately, you know, some of the younger persons coming up, they feel that, you know, the older persons are not as productive and they don't know anything, and, you know, the young people are the ones who know everything. So we have to combat that cultural stigma, so we can make sure that, you know, we allow our older persons to share with us all of the knowledge that they have, because there's so much of our cultural traditions that we can potentially lose unless we open that conversation and we share with our older persons and have our older persons share with us, so that we can transition that knowledge. So we know that with growing old, there are those chronic non-communicable diseases, and these are the things that we need to educate and prepare for. And these are the things that really drive the use of health care. You know, we have the hypertension, the cognitive disorders, you know, older persons, you know, start to get dementia. You have the osteoarthritis, you know, the congestive heart failure, diabetes, all of those things come into play and make life challenging for the older persons and the family. So we want to make sure that we talk about this evening ways in which we can empower the older persons to manage their health. We know that it's just natural that we will have more health challenges as we get older, but there are things that we can do, one, to prevent it, and then to combat it if indeed that's what we are faced with. So become physically active if you're not as yet, and make sure that, you know, you keep moving in order to keep that heart ticking. We want to talk about what you eat matters. Ensure that you have regular age-appropriate checkups. Engage in social activities. Make sure that you have that social support, and that there are genuine friends that can support you when you have some of those challenging issues to deal with, and otherwise as well, on a regular basis. And engage with groups that can help you learn more. I know there's a number of church groups. I know the ADRA group, the Seventh-day Adventists, they do a lot of health fairs. You know, the HSA does screening. St. Matthew's, a number of groups do screening. We have the Cayman Heart Fund, we have the Cancer Society, the Breast Cancer Foundation. All of these non-for-profit groups provide education on how to make sure that we do age-appropriate screening, as well as, you know, what happens if you have various illnesses. So engage with them, learn more, because education is definitely empowering. And we also have to make sure that we manage end-of-life care. Like I said, start the discussion. Make sure that your loved ones know what your wishes are. So when it comes to the end of life, because even though we're trying to make sure we live forever, the natural progression is at some point in time, we are going to die. And we need to make sure that our loved ones know what our wishes are so that we can honor those wishes when the time comes. So areas for discussion here this afternoon, after we hear from the panel, is how do we prepare the next phase of our population? How do we encourage our older persons to maintain their sense of independence in their daily activity, regardless of their age? How do we encourage and promote an attitude for the younger generation to be able to start saving? Start now, recognizing that we are going to get older, and start preparing for our finances for that. And also, what is the role of the church? How does the church help our older persons in preparing our older persons for that aging transition, and also for supporting them in their later years? How do we develop transportation arrangement for older persons when they're no longer available to drive? And what are the unique nutritional issues for the older persons, and how can they live more active and healthy lifestyles? How do we promote and encourage older persons to develop a living will? This, I know, is a particular challenge, and I'm sure there's going to be a lot of discussion around that here this afternoon, because we have a very spiritual society, and this is something that is a very difficult topic when we start talking about end-of-life wishes. It's a very difficult topic for faith-based persons to really talk about. And how do we encourage the transfer of knowledge, the ethical and cultural values from older persons? How do we make sure that we embrace and we share that information so that, you know, we as a country will benefit from those older persons, all the knowledge that they have? So these are the areas that we want to discuss here this afternoon after our panel shares with us. And I'm going to introduce the panel one at a time. And then they're going to share with you just a few minutes. Some of them haven't really prepared anything, but they will just speak from their personal experience. And then we're going to give you the opportunity to share with us and ask us questions. And I'm sure that there's going to be a lot of information. I see two other members of the Older Persons Council has just joined us. Thank you very much for joining us this afternoon. So the first person on the panel that I'm going to introduce is Mrs. Felicia Robinson. She's a director of the Department of Children and Family Services. So Felicia Robinson, previously director of Human Services and Family Affairs for the St. Lucia government, is a director of Cayman's Department of Children and Family Services, where she brings a wealth of knowledge and experience to the important work of this government, that is, the protection of children and strengthening of families. She has over 20 years of experience in social work, public policy, financial oversight, and working with communities. She has a master's degree in social and public policy from the University of Leeds, a certificate in social work, a diploma in legislative drafting, and a bachelor's degree, all from the University of the West Indies, Cave Hill, Barbados. She also received a Bachelor's of Law degree from the University of Leeds program at the Truman Bodden Law School. So join me in welcoming Mrs. Felicia Robinson.
Thank you, Ms. Lizette. We were here speaking to the fact that Lizette has done such a wonderful introduction of the topic that we would really recommend that we go into the questions at this point. Very little has been left untouched. I just want to point out that this is also the month of older persons. We celebrate it in October. So it is really a pleasure to have our older persons among our audience, as well as many of our caregivers for older persons within this group. So we're really happy that you've joined us for this discussion. We have had several concerns, I think, for older persons. And if I can just add some other little bits of statistics, and I'm sure Ms. Linda will join me with that. When we think about the provision that's made for older persons who cannot age within their home, we have facilities that perhaps offer spaces across Cayman Brac and Grand Cayman of just over 50 spaces. And that is really an inadequate number when we consider the demand that is made on a daily basis by persons who feel that they no longer wish to or are able to care for their loved ones. And sometimes we talk about it being a family's responsibility, but in essence, we often forget as well that there are some older persons who do not have children, who do not have that next of kin person who can care for them. And therefore, our discussions and in making our plans, we need to be aware of that particular group of older persons who would be increasingly vulnerable for some sort of caregiver. So that's one of the issues I wanted to flag. The other issue, I think, is the issue of housing. As we get older, many of us have lived in situations where we have not been able to afford a home. And many of us within our community, even though we may have had a home when we were younger, as we got older and our income was reduced, we may have lost that home. So we have an increasing amount of, or potentially there's going to be an increased amount of older persons who will find themselves vulnerable, not only in terms of the quality of their housing stock, because it is not being repaired or kept up to date, but they may also find themselves without having a secure housing situation. So that's another one I wanted to raise. In terms of what do we do, as I said, we're celebrating Older Persons Month. The challenges Ms. Lizette has outlined for the most part, and that has been done very comprehensively, but it is clearly not the responsibility of governments alone to address the needs of older persons. And that is a message that we communicate to our community at large. It is a partnership with state, families, as well as other persons within the community. And as we celebrate this month, we are speaking about valuing our older persons and respecting their wisdom. And I believe that there is a space for us as a community to look at how we treat our older family members, because our statistics show that the abuse is not directly by someone that they pass on the streets primarily. It happens by someone who is very close to them, a child or relative or someone there that they're connected to, or a caregiver. So we challenge in this discussion to look at how do we really look at valuing our older persons and respecting them and making space for them, even beyond that 65 magic age of retirement, to make their contribution back to the society.
Thank you very much, Mrs. Robinson. Okay, our second panelist is Mrs. Felicia McLean. Felicia was born in New York and raised by her Caymanian mother, Beulah McPhail, in the Cayman Islands. She trained as an LPN at the Cayman Islands Government Hospital and graduated as a licensed practical nurse in Cayman in 1995. She then worked in the Cayman Islands Hospital in many areas until traveling overseas to pursue her degree in nursing at Barry University in Miami, which she received in 2003. Felicia started working with the Cayman Hospice Care at the end of 2005 and was certified as a hospice palliative nurse in 2007. In 2012, she became clinical manager to the clinical staff of the organization, and she was recently promoted to the Director of Operations and Nursing. Felicia is married to Kyle McLean and is the proud mother of 4 beautiful children. She's a volunteer youth leader at the First Baptist Church and is passionate about support of the youth as she is about supporting the dying. Felicia is devoted to making a difference in the lives of the terminally ill. She says, "I love caring for the terminally ill in Cayman. It is incredibly rewarding." Mrs. Felicia McLean.
Thanks, Lizette. I agree with Ms. Felicia. You covered it amazingly, an overview of our elderly in general. I don't think you left anything out. I will be the first to say I was one of those ones not quite prepared for the 5-minute talk, so bear with me as I probably will just give you some things to think about in general. So some quick notes in there. One of the things I know we find in regards to hospice, palliative care, end-of-life care, like Lizette mentioned, is the fact that we have not adequately prepared ourselves or our elderly for those conversations. And it's not entirely all our fault. We have developed in the Cayman Islands very fast over the last 40 years. I tell people all the time when I can remember taking water out of a bucket and going to the bathroom to bathe, and we have running water, and that's within my lifespan. We've just grown so fast that we've grown without thinking about necessarily the medical or the licenses that need to happen, legal benefits that'll happen with living wills and that type of stuff. So I'm really, really happy that we're at a stage where we're finally starting to address the inadequacies in our laws that will empower not just our elderly, but our island in general in that regards. And so when I think about having a conversation about how do we do that and what are we going to do with talking to our elderly, what we find a lot of times is people are afraid to tell their loved ones that this is their diagnosis because that means that they're going to just give up. And if we talk about empowering a patient, it's that patient's right to know what the deal is. And if they choose to give up, then that's still their right. And if they choose to fight, then they know what they're fighting for. They can't fight something that they don't know. And we need to step away from not giving people that right because we want to make that decision for them when they're a grown adult, especially with the elder population in that regards. I know there's a lot of fear related to death and dying, and I recently had this true scenario just a couple of days ago where I was sitting in the car with my 4-year-old daughter, and she says, "I want to die." And I go, huh? I mean, there's a lot of death talk in my house. I was just cover that with, we're always talking about life and death and people dying. And she goes, and I go, well, why do you want to die? And she says, because when you die, there's streets of gold and there's beautiful things and there's all these, like she started naming out all the great things in her mind that'll happen with death. And we are too afraid to talk about death in general that we don't look at all the good parts about what we say we live for every day. For those of us who are that faith community that believe that there is another great thing to come in death. If I was sitting with other people, it'd be a great segue into, well, what would your wishes be if you did die? So when you are talking with your loved ones and when you are around elderly people and just your sisters, your brothers, your mothers, your husbands, find those opportunities, don't shun from them because like Lizette mentioned, if we don't ask them what they want, well, when they're in that situation and we have to speak for them, we won't know what they want and we can't make the best decision for them. So that is definitely one area. And I also want to mention what we see a lot when we interact with patients in the home is the fact that the cost of living has also been another thing that's affected us a lot lately. And because of that, our loved ones aren't able to stay at home and care for their grandmothers the same way the grandparents aren't caring for the kids because they still have to work. And we find a lot of our elderly who should be able to slow down in life, not able to slow down because they have to still go to work, to pay the mortgage, to pay the bills, to get the food, to have what they need. And I'm not sure how we tackle that particular one, but that is a challenge that we find that people can't stop. Or that same insurance, they need to keep the insurance going so that they can get the health care they need to take care of the diabetes and the heart diseases that they have. So it's definitely another issue we need to look at in that regards. And then for those that are shut in our community, our elderly, we find a lot of times I think we're guilty of it in hospice care sometimes going, well, no one comes to look for them, the family's never there. But I have a similar situation where my husband's grandmother is always at home and she'll call us and go, I have some pumpkin and you should come get some. And my husband says she doesn't really want to share the pumpkin. She wants to see the kids. That's how she thinks she's going to get me to come by to see the kids. And I have to admit, I'm ashamed because my life is so busy that I don't make it there enough. And I won't say we're all guilty. I can say I am guilty that I don't make the time for the elderly people in my very life. And if we stopped and reflected on what's important and what you want to be a part of, the time when you can spend time and she can hug the kids and the kids can meet her, that's what we need to captivate on. That's what we need to make more important in our lives. And I know it's hard because we have bills to pay and we've got lots going on, but our elderly devoted a lot to get us to where we are today, and we need to start taking the time to give them back what they deserve.
It's a good thing you didn't prepare, Felicia. She's a natural. Our next panelist is well-known Pastor Alison Ebanks. Pastor Alson is the senior pastor of the Church of God Chapel in Georgetown, a position he has held there for the past 26 years. He and his wife, Norma, have been married for 45 years. He doesn't look older than 45. And they have 2 adult children and 1 grandchild. Pastor Alson is also the vice chairman of the Cayman Islands Ministers Association and the president of Prison Fellowship Cayman Islands. Please join me in welcoming Pastor Alson Ebanks.
Thank you, Lizette. Thank you. I think I was invited to join this panel not because I'm a pastor, but because I'm actually one of the elderly. I'm on the cusp of 70, and one of the things that I recognize now is that I am among the eldest in our family. My father and mother have passed on, and so all of my nieces and grandnieces and others, they're looking at me, and I have to recognize that they see me as old. I don't always think that I'm old, and I think that's part of the problem of getting older. One of the problems of getting older is that the body is changing, but the mind doesn't know that the body is actually changing. And because of that, we do not plan for aging early enough. One of the things that we had to do as a family, was to retrofit our parents' home because they wanted to stay, and we wanted them to stay in their home. And both our parents passed away in their bed. My mom was 87, my dad was 93. So when do you design a home for aging in? That's what it's called, eh? You design it the first time you build the house in Cayman. Because as we know, we don't have a whole lot of land, and you're going to run out of it soon. So most homes are not built for elderly people or for aging. The doorways are not wide enough. The corridors are not wide enough. The access to the home consists of sometimes too many steps. And so the reality is that, well, even the bathrooms. I have a home built for young people. The bathroom, the actual entrance to the bathroom is 24 inches wide. That means no wheelchair. I don't plan to be in one, but nevertheless, no wheelchair can actually get through the door. These are the kinds of things. So this conference is about, or this discussion is about empowering the elderly. When do you empower the elderly? Before you're old. So if you are not on the cusp of old age and you are planning to build a house, your house should be designed for aging in. Even if you don't age in it yourself, somebody else could and should. So that's one of the things that I think that needs to be solved at a planning and design level. That we're not just allowing people to build houses with the assumption that they're going to always be young, because that's not going to happen. You either die young or live to be old. Those are the 2 choices still left for all of us. Another issue has to do with this business. I heard a couple of years ago, not the present Minister for Health, it was another one a few years back, who said that people are living longer and better. The longer is yes, the better is no. Just pay a visit to HSA Hospital. A lot of our friends are just hanging out there, not because for social interaction. They're living longer, but they have what was referred to as these lifestyle illnesses. And one of the reasons that we have the lifestyle illnesses is because of the prosperity that Cayman has experienced over these last 40 years. We're not just living longer, but we are actually eating ourselves to death. We are eating ourselves to death. If you are anything around my age and you're a Caymanian, we did not have 3 big meals a day, and nobody died of starvation. Nobody died of, well, I say nobody, I mean, because I haven't got the statistics. but primarily people lived to, they were healthier. But the point is, right now we've adopted a lifestyle that is not healthy. Besides the fact we have things that we never had when I was growing up. We had no restaurants to eat out at, regardless whether we were eating late at night or not. They didn't exist. So we had a breakfast, which often was not large, and then we had one main big meal sometime in the afternoon, and then supper was so light that it was tea, any kind of tea, with maybe a slice of bread, and that was it, and you went to bed, and nobody died in their sleep from starvation. So I think the medical fraternity will tell you that we are eating ourselves to death. And this is how we celebrate our prosperity, a very poor way to do it. And that's one of the concerns that I have. I have decided that you can do something about your health. Empowering. I don't think that we actually communicate that well enough to our elderly. I think a lot of the folks, as they get my age and older, kind of develop a victim mentality. Somebody else is responsible for my health. The doctor is responsible for my health. The pharmacist is responsible for my health. That, you can't empower people that way. You cannot empower people that way. I am responsible for my health. And because of that, I wake up 5:30 in the morning and go to the gym and exercise until I am tired and painful, because I have decided that I can still do it. Maybe I'll get to the stage where somebody has to help me to get out of bed to do it. But my point is, I'm simply taking responsibility for my own health. And if we're going to empower people, we have to help them to understand that, to accept this idea that once a man, twice a child, that's not a healthy way of looking at life. We can be healthier for a longer period in our lives if we take responsibility for it. I think the issue that we face in the church often with elderly folks, we face a lot of different kinds of issues, of course. One has to do with the issue of the social financial thing. The fact is that now you are retired. When did our pension system come into place? 90 what? 97. All right, so that was a few years into the time I was working there at the church. So if I retired now, my pension would last me, well, if I took my wife's as well, about 2 years. And if I was very frugal and went back to eating the old Caymanian way, light breakfast, one big meal, no supper besides tea, maybe I would do it. So we have that issue. That's a real serious issue. But this is because of the fixed income, but not a fixed cost of living, a rising cost of living. And that will probably continue to be the case. So these are things that, I didn't write all the notes down myself, but these are things that I deal with on a regular basis as well. And so being in that category of the elderly, I thought I'd try to defend us a little bit and hopefully say something. But pass it on to you who are younger, and if you have the opportunity to do something now, do it. Because that's one way to empower yourself as an older person before you get there.
Excellent. Thank you very much. Thank you very much, Pastor Allison. That's definitely a lot of food for thought. We really didn't invite you here because we thought you were an older person, because honestly, I didn't think that you fit that category. Having said that, though, that's very, very insightful. And the point that you made in regards to our homes is really, really critical. We see that every day. We have patients in the hospital that can't be discharged home until we help them make renovations at home, that we can push the wheelchair in, that we can actually fit a hospital bed in, and these are challenges that we live with on a day-to-day basis. So that's very good advice for those of you who have young ones that are building or you're planning to build. Think about aging in that home, or someone aging in that home. Right, so we're moving on now to our next panelist, who is Dr. Andy Schillenford, a general practitioner at the Health Services Authority. He's an experienced general practitioner with demonstrated history of working in the health and wellness and fitness industry. Skilled in clinical research, medical education, medicine, advanced cardiac life support, and patient safety. He's a strong professional with an MBA focused in business from University of Leicester. Dr. Schillenford served on the popular once-weekly doctor's orders program since 2013 until just last year. His wife, Mrs. Angeline Schillenford, served for several years as the president of the Cayman Academy's Homeschool Association. Dr. Schillenford has practiced in both the UK and Cayman Islands with over 12 years in the Cayman Islands here at the Health Services Authority. So join me in welcoming Dr. Andy Schillenford.
Right, good afternoon. I would like to join Ms. Felicia, number 2, and say that I think most of what could be said about healthcare has already been said, and very insightful talk by Pastor Ebanks as well. Thank you for saying that. But just to say from the general practitioner's point of view, the issues regarding empowerment of elderly people. Before we can speak about that, though, we need to recognize that sometimes we say elderly people, but we have to recognize that there's a wide spectrum of people in that age group, even though we might put a number to it and say that it's 65 or 75, that there are people who may be 65 and very unwell and people who are 85. I'm sure my esteemed colleague, Dr. Christian, where is he? We recall that there are people that we used to see when I worked in West Bay, who came regularly at the age in the 80s and 90s to get their Viagra prescriptions. So, there's no fixed definition that you could say that when you reach a certain age that you are old. You can be young in age and still be old in health, and be old in age and still be young in health. Having said that, though, we do recognize that there are certain things that do, certain changes that you do get as you get older as a person, all of us as we get older. There are certain changes in your body that you really cannot resist at times. We recognize that, as you get older, your hearing gets worse, your teeth fall out, your hair gets thinner, your skin gets thinner. There are certain things that you can't necessarily change. And as a result of these, this basic, changes the physiology of the body, there are definitely medical conditions which become more common as you get older. And as a matter of fact, most of the things that we see as doctors, we would naturally say that they are probably more common in older people. So as you get older, diabetes is more common. And even in our society, as we say, in terms of our more Western habits, this is becoming even more prevalent. High blood pressure is more common, cancer is more common. So we find that older people tend to have a higher burden of health diseases or healthcare issues as they get older. At the same time, while you are becoming older and more likely to get medical problems, we do recognize that as people get older, they do become more limited in terms of their independence and mobility as well. So as you get older, your bones get weaker and your joints go out, so you can't walk as far and as fast and as often as other people. The hearing is worse, so you do depend on other people to explain things to you at times. Your vision goes, so you can't walk, you can't drive as safely as you used to in the past. So this combination of people becoming older and at the same time losing their mobility does cause them to lose their empowerment as they get older, regardless of the fact that some people tend to remain stronger as they get older. And as general practitioners, we do see quite a few people who are limited by their mobility and at the same time have a high burden of medical problems. So you'll find that there are a lot of older people who might have, 4 or 5 or 6 medical problems on their list, and they might be on 10 to 15 medications, and at the same time, they can't see the medications, they can't hear as well. So you do have to depend a lot more on other people to manage your life. So in terms of what can we do to empower older people as they get older, first of all, as doctors and as society as well, we need to try our best to make sure that they don't get sick, as far as possible, by ensuring that they get regular attention from their medical providers. There are certain medical screening procedures that we recommend for older people. For example, as you get older, you're meant to have your cancer, your bowel cancer checks at age 50. There are many of our older people, from age 50, sorry, there are many of our older people who don't get these checks, and we do find that people develop medical problems because we did not have the initial screening. There are a lot of older people, you should have your regular blood pressure checked. You should have your diabetes, your blood sugar checked regularly. Your cancer screening for colon cancer, as I mentioned just now. But many of our older people do not get these things done in advance, so it increases the likelihood that they will have severe medical problems, which then make them more dependent on other people. So we need to try our best to make sure that our older people have these basic visits with our doctors and have these basic medical checks done. If you could visit your family physician, your GP, there are quite a few screening tests that people should have at regular intervals as you get older. You shouldn't wait to have the sickness. You should have these things checked before you get them so that they don't make you as sick as you could if you got them. So we do recommend that we take the older people regularly to see a physician so that we can have these checks done. And another thing that also I find limits the empowerment of older people, it was mentioned before, but it is a cultural attitude. I think it's probably a Caribbean thing more than other places, that when you get older, a young person must speak for you. Yesterday, I had a patient bring both of her parents to see me, and she insisted that they wait in the waiting room, and she will come and talk to me. I humored her because, this is our culture. If you try and fight that, you get in trouble, people will start cussing. So spoke to her briefly, and then explained that before I can even open their medical records, I have to see them first, and you have to have their permission, even though you brought them here and you drove them here. You have to have their permission for me to discuss the healthcare with you. I brought them in, and they were two quite lucid and quite alert elderly people. And we had a nice discussion among ourselves. But we need to recognize, this is something that may not necessarily be recognized by family people here, that we believe that when a person gets older, the young person must talk for them. We have to recognize that older people have autonomy as well. Even if they have dementia, they still have a right to their own health care. And dementia is not something that is absolute. Even if a person has dementia, and it's written in the book they have dementia, it doesn't mean that they have no rights. There are certain things that a person with dementia still can manage on their own. And as physicians, we still have to assess them and find out, even if you have dementia, can you manage this aspect of your health care? And if you can, nobody else has a right to do it for you. So we as a society, even though it's a Caribbean thing, maybe, we have to recognize that even if people get old, they do have the right to their own autonomy, and they do have a right to manage their own life. And finally, just to say, those of us who work together know that I had left the country last year for a year, been in the UK for a year, working as a general practitioner. And just to mention some of the ideas that may be pertinent to this discussion, and two of them in particular. One is the fact that in order to get reimbursed as a GP over there, there is an actual program where GP practices have to have care plans for elderly people. And the care plan it's actually quite a long and detailed process where you have to ask the older person details about what they want to do if they become unwell in the future. So if you're unwell, do you want us to call the ambulance? That has to be ticked. Do you prefer to be treated at home? Would you prefer to die at home? Do you want to have medication in a drip? Would you want to have injections? All of these things have to be documented in advance so that the older person, if they become a bit frail, these things are documented. I think that helps the older person to have some control over their future just in case they do become unwell. So that is something that we can look into, making sure that we recognize older people as a group. I know it was written on the slide that this is not recognized in the Bill of Rights as a particular group, but we need to have a program specifically for older people where we look into their healthcare planning. And another thing that I wanted to mention from that UK experience as well is a very interesting concept called social prescribing, where if you go to your GP I don't think this is just older people, but as a member of society in the UK, the GP can actually prescribe you a social coordinator. So if you are lonely, you can go to the GP and he can prescribe somebody who will find things for you to do or people for you to talk to. This is a prescription. And if you need exercise, they can prescribe exercise. You can go to a gym. This is prescribed by my doctor. I'm going to get doctor. I've seen some programs under the social prescribing project where people are actually prescribed to go to their local pub and have meetings together as older people and sit and chat. This is prescribed by a doctor. I mean, this might be going far, I suppose, to prescribe going to the pub. But, I think as a concept, the idea, we did mention that as you get older, loneliness is an important thing. And there may be many of our older people as you get old and you don't have as much mobility, who just sit at home and watch TV. And I'm sure it would be good if we could have some programs here where we could, maybe not the GP necessarily, but we could provide avenues for older people to have more social interaction with people of their own age. So this is just two things that I thought I should mention as a healthcare provider that we could probably copy from other countries. I'm sure there are lots of other things that we could do as well. All right.
Very good. Thank you, Dr. Schillenford. Before we move to our next panelist, I want to do a quick survey. I want to see by a show of hands, how many of you in the audience is under 65? That is extremely impressive. Give yourself a big hand of applause. So what that says to me is that you are taking the responsibility to learn about how to be a caretaker, how to be a better family member, and certainly how to take care of yourself, how to prepare for yourself as you get older. So that's very, very impressive, and I'm really, really happy that we have so many young people in the audience this afternoon. So we're going to move on to our next panelist. Because we haven't talked so much about this area of growing old as yet, and I know that this will be very interesting. Ms. Simone Sheehan is a dietitian with the Cayman Islands Health Services Authority, and she qualified with an honors Bachelor of Science degree in Human Nutrition and Dietetics from Trinity College, Dublin, in 1989. Simone worked in Ireland for 21 years, specializing in critical care, renal nutrition, and then worked in the UK for 2 years providing nutrition services to a diabetic center, ENT center, and critical care. Simone moved to the Cayman Islands in 1996 and commenced work with the Public Health Department in May of 1997 until February 2003. This involved developing and implementing the public health nutrition programs, including those in schools, but several other community-based projects, including home care nutrition in private homes and community residential homes. In 2003, Simone joined the Georgetown Hospital until present day and provides general and specialist clinical dietetic services to inpatients as well as outpatients. She is a member of the Child Health Task Force and runs a monthly bariatric support program. She has completed the Diabetes Educator course, Adult Weight Management course, and she's a facilitator accreditation and practicing certificate in the Heart Manual. And she has attended several conferences and congresses, most recently the FNCE, which is organized annually by the Academy of Nutrition and Dietetics. She is a member of the British Dietetic Association, the American Academy of Nutrition and Dietetics, and is fully registered with the UK and CPAM here in the Cayman Islands. So join me in welcoming Ms. Simone Sheehan.
Thank you, Lizette. Good afternoon. I hadn't really prepared that much, so apologies, but I'll jump in as best I can. We know that the older population is quite a diverse group and have very varied needs, but nutrition does play into every aspect of that. All the issues we touched on so far today all have an aspect of nutrition to them. One of our biggest challenges when working with the older people or older population is maintaining good nutritional status. Because there are so many factors that are working against them, trying to ensure they continue to have a healthy diet, most of which we touched on today, right up to housing, because if you haven't got an adequate kitchen and you don't have a proper stove and you don't have a fridge, and then if you don't have the money to put the food in the fridge, and if you're in pain or you have limited mobility, you can't stand in the kitchen for very long and prep the food. If your vision is going or your hearing, you may not hear the microwave alarming. You may not have the strength to turn the tap on and off. All those little simple things all have knock-on effects on nutrition. Food has a biological, social, psychological, and economic role, and this very much plays into the elderly population because a lot of enjoyment and pleasure occurs around meal times. But if you're eating on your own and preparing food just for yourself, it doesn't seem to have the same appeal usually. There are some key nutrients that we definitely keep a special eye on when we're talking about the older population: calories or energy, protein, vitamin C, vitamin D, zinc, fiber, because constipation can become a problem. But it's important when we approach our care of the elderly that we also involve everyone who's involved in the care and keep the lines of communication open, whether that's family, carers, healthcare workers, because sometimes they'll come to see me and then they'll go to see a GP, and we're not always necessarily communicating and sharing patient care, really. So that is something that I wanted to mention. We know that this group in the population have changed needs as we all get older, but they also have issues with absorption, impaired ability for their bodies to use nutrients in the same way. So they do require quite a good amount of nutrition care, and sometimes it's not always something that we immediately think of. We think of doctor's visits, pharmacy, making sure they have their medications, and sometimes nutrition or diet's not always high up on that list of priorities. And many of these patients have what we call sort of polypharmacy, which means that they're getting lots of, as Dr. Schillingford alluded to before, they may have 6 conditions, but 15 or 18 types of medications. And lots of these medications interact with each other. They can have side effects such as taste and change, dry mouth, upset tummy, and bowel and gut issues. So, this all plays into the nutrition. Of course, then you have people in their homes, you have people in healthcare facilities, patients who don't have anywhere to go, who end up becoming long-stay patients at the hospital. We have some care residential facilities as well in Cayman, and there are some different needs for each of those institutions or facilities. I was reading somewhere where a report was produced in the UK in 2011, and the same patterns kept emerging over and over and over in a hospital setting where I work, for example. Some of the problems were that the patients weren't physically able to reach the food to eat it in time while it was hot. Seems like such an easy thing to remedy. being interrupted during mealtime, so not having dedicated time set aside for meals. So you'd be called away to X-ray or a CT scan, or it's time for your blood pressure check or whatever it may be, and that interrupting of the meal. Patients' needs not always being met, or their food preferences, likes and dislikes, religious, cultural requirements not always being identified either. And even simple things like patients not being able to wash their hands before they have their meals in the hospital. This was in the UK, a report that came out. So, this is all useful information that we can use ourselves in our hospital setting to make sure that the meal experience in the hospital, because patients look forward to their meals, particularly when they're in hospitals, but as well in their homes. But they do look forward to their 3 meals that we provide for them. So we want to make sure that we make it an enjoyable experience and one that enhances their overall positive experience in the hospital as well. Thank you.
Thank you very much, Simone. Thank you. I'm sure there's going to be lots of questions from the audience later about some nutrition tips and tricks. So our final panelist, before we open it out for questions and answers and comments from the audience, is Mrs. Linda Mitchell. She is a manager at the Pines Retirement Home here in Cayman. Linda works with families in our community to assist the elderly with their care requirements. The Pines Retirement Home is a nonprofit charitable organization established to provide residential accommodation for the elderly, primarily to meet the needs of the independent elderly during their retirement. And we look forward to hearing from Ms. Linda this afternoon as she works to keep meaningful activity opportunities available to the elderly, because as was mentioned by Ms. Felicia Robinson, there's some persons who don't have children, they don't have families, because maybe they're the oldest of their family and all the others have gone on before, and they're alone at home. So the retirement home definitely serves a very, very important role, and we're very blessed to have the Pines Retirement Home in Cayman, and we look forward to hearing what Ms. Linda is going to share with us this afternoon.
Is it close enough? Can you hear me? Okay, good afternoon, everyone. Nice to be here. We hear a lot about empowering the elderly. I'm going to stray just briefly after I make a couple of comments about how do we empower the caregivers, right? Because I believe that many of you are in that field of work. Is that not right? How many of you work in the field of caring for the elderly? Okay, so a few of you. And how many of you care for your family members who would be informal caregivers? That's okay too, because we'll need that information as we get older. First of all, it's important to understand that the aging process begins at birth and it ends when we expire, right? So that's important to keep that in mind. Ms. Lizette presented some charts on the aging population, and in the Cayman Islands, these are statistics that are brought to us by government, the Economic and Statistics Office, and at the labor force survey in 2017, there were 6,190 elderly in the Cayman Islands that are 60-plus years, that meaning that they're at least 60, but they could be in their 100s, right? What's important to understand is that 10% population of the 62,000 that was noted, only less than 1% of that population are housed in nursing homes or retirement homes, right? So that tells you there that Cayman is a wonderful place to grow old, right? Because our elderly are being taken care of, and the majority of them are being taken care of by informal caregivers, which are family members. We often spend a lot of time talking about how do we empower the elderly. But I want to stray just a little bit and talk about how do we empower the caregivers, because they have to be empowered as well. Being mindful that in order to do this type of work, it has to be a passion. It is not something that we can throw you in and ask you to do, right? If it is a passion, you're going to work hard at it, you're going to spend a lot of time in your academics. You're going to go and get additional training. You're going to go and take courses in geriatrics. You're going to actually learn how to care for the elderly, because there is a process. As the doctor spoke about earlier, as we age, then we are in need of different things, right? Some of those things is, how do you care for an elderly that can't talk, right? What do? You need to know exactly what it is that you're working with and to who you're working with, right? You have ambulant residents, those are the persons that can get up and walk around, and you have the non-ambulant, those that are practically bedridden. There's a process in caring for this population. You cannot allow an elderly person to lie on their back or on their side 24/7, right? There's a process. You got to know how often you have to turn them, how often you have to feed them, right? And sometimes just to sit and just to chat, even when they can't chat with you, right? So, having said that, we go through a lot of this at the Pines Retirement Home. Roughly 28 of our residents are completely bedridden. Some of them are tube-fed, some of them tube-fed, meaning the NG or the PEG tube. And you have to know when to feed those residents. You can't feed them all at one time like we do sometimes. We'll just sit down and eat a big plate and we're done for the day. But theirs is a little bit slower. It's at a slower pace because the body has to have the opportunity to digest the food that they're eating. We have residents that are on soft diets. They can't chew, they don't have teeth. We have residents that don't have family members. We have residents that do have family members, but family members don't come to visit with them, right? So we have to empower the caregiver so that they will know what it is that they need to do and make sure that the persons that we're caring for are getting the best possible care. We're open 24/7, that's 7 days a week, 24 hours a day. We have a staffing of ranges anywhere from 42 to 45. These are professional people in the field of caring for the elderly. Nurses, we have 6 registered nurses on staff. This is day and night. There's a registered nurse on duty at any given time during the day. And that's important because the nurse has to be there in order to handle any medical issues that may arise. We do not have a doctor in-house. We do utilize the GPs from Health Services Authority. They do come over every Tuesday and most Fridays to look at the residents. If there's anything that need to be looked at, the nurse in charge, which is the nurse supervisor, will put together a list for these residents, and the doctor will see those patients. We don't really refer to them as patients. We really refer to them as family members or residents, right? Because patients, you don't want to seem like you're in a hospital and that they have to be in that type of setting. So it's important that you know what to do in order to give the best possible care to the person that you're looking after. Because it was very difficult for the Pines to recruit local caregivers, sometimes you have to fix things yourself, right? So what we did, I went overseas, looked at curriculums on training to care for the elderly, and we found a book by Mopsley, which is an excellent tool, and we teach a caregiving course at the Pines every August and every February. It is a 10-week course, right? The course is $450, and it is taught by professional people. We have a class right now. There are 11 students in that class, and all of them are scoring above 80%. So the reason they're doing so well is because they have the passion to work with the elderly. So I have some forms I'm going to leave for you. If any of you want to get in that business, you can fill out. The classes do fill up quite quickly, and we do have a limit for the course. So if this is your field of work and this is absolutely something that you want to do, then you want to consider that, okay? Thank you.
Thank you very much, Ms. Linda. We're very, very grateful to the work of the Pines Retirement Centre and the way that the Pines Retirement Home embraces the community in order to be able to offer various activities to the older persons, the older residents there at the Pines. So we're very happy that the Pines is so welcoming to embrace the other members of the community. So ladies and gentlemen, this is the time now to hear from you. You have the opportunity to ask any of the panelists any questions, or certainly to be able to offer any advice or tips that you have that you feel the general audience can benefit from. If you do want to ask a question or make a comment, there's a mic runner in the back, so please raise your hand. We'd like to hear from you, so we need you to use the mic. Any persons? We have a question over here.
Hello, good evening. So Ms. Felicia, the first one. Yes, I have a question, actually 2 questions for you. So the first one is, how can we empower those older adults that are disengaged? Because as you mentioned before, that one way to empower these older adults is for them to remain active. But what about those who are purposefully disengaged from society? How can we empower them?
I'm not sure that they purposefully engage. I think the stigma that comes with aging does not allow them to feel that there is a space that values their contribution. You know, we have many older people who reach the age of retirement, for example, and whether or not they like their birth date signals that they need to exit formal employment. And sometimes that impacts upon them and their self-esteem and how they define themselves. And they feel, well, I've got no more worth. They just want me to go and sit. And that disengagement process happens, not because they've deliberately made that decision to do that, but because the psychology of sometimes feeling rejected from having worth and being able to make a contribution to our communities. So I think the conversation that needs to occur within our community is that, you know, older persons have value, they still have a contribution to make. You know, sometimes even a conversation happens where you may say, oh, my dad just passed, and somebody will say, well, how old was your dad? And you say, oh, 83, and they say, oh, well. You know, which, you know, there's a presumption in there, well, they're old so they can go. But if you said, well, you know, a family member just passed and they're 42, they say, oh, God, so young? And it is, well, you feel that they have something, they left prematurely when they still have something more to offer. Mm-hmm. So I think it is resetting our minds, how we think, how we value our older persons, and creating the space to say to them, there's still a contribution that you can make. And it starts within our homes, within our families, you know, and I have adult children, and I do not say to them, well, I have no value anymore around here. I still say I'm still the boss. You know, so even those conversations that we have within our homes, we should speak value to ourselves, and we should speak value to what we can still offer to not just our families, but within our communities and within the work environment.
Thank you very much, Ms. Felicia. Anybody else want to add to that?
Oh, my second question.
Let me share this. I used to go to a regular type gym, you know, where anybody could go, and older folks would go and get on one of those things that move, and you're just walking like you're in the park. And nobody seemed to think that that was unusual, because old people can do that sort of thing. And then I decided to, well, actually I was talked into it by my wife, to go to a different gym where young people don't really go. So I'm like a mascot there. And when I show up and I'm doing something, they say, very good, Pastor Al. You know, it's like they're expecting me to fall over at any time or whatever. But when I do push-ups and pull-ups, they take pictures because they want it to say, you know, put it on what's it called?
Instagram, please.
Instagram. They have a picture of me doing you know, but because I'm simply piggybacking what Felicia said. This idea that as you get older, you just either just die or you fade away, but you can't do some of those same things. And unfortunately, I think as we age, we start believing the lie or the presumption that people have that that's not the case. So I just keep going and proving to myself that at least I'm able to sometimes do as well as some of the younger ones.
That's right.
And some of the novices there, they want to hang out with me because that way they don't look so bad. So you see, we serve a useful purpose all around. But I think up here, We have to change the way we think about our own aging process and not be dictated to and say, well, now you've reached 60, stay home and watch television or something.
Yeah, thank you very much. Dr. Shilver, you wanted to add something?
Yes. In the UK, it's the only statistics I have, 1 in 5 elderly people is considered to be suffering from depression. So I don't know what the statistics are for the Cayman Islands, but we should be careful to think that people who may seem socially withdrawn because they just choose to, it might be that they're suffering from depression as well. So those people, I don't know if we particularly look for depression in older people here as much as we should. So some of these people who may seem to be just wanting to be socially withdrawn may also be suffering from depression. So that's something that we should keep in mind as well.
Very good point. Felicia, you want to add?
I'm just going to piggyback on Dr. Shillingford in that regards. What I find one of the areas that I feel we could do better on as well is bereavement support. Cayman Hospice Care does some, but we only do bereavement support on the patients that come within our services. So the mass majority of people who lose loved ones who have not touched our services has no one necessarily besides maybe the church community checking on them. And so depression is that. And we do ones where we do visits and we check in and we're asking them and we're looking for that. But who's looking for it for other people who've lost their loved one, their mother, their father, their spouse? Or for the elderly in that regard, you know, a lot of times they'll say, well, when this one dies, that one's going to die really soon afterwards because they're like this. But if they have that engagement or if someone's checking on them, they may not have that same problem. And so it's definitely something to look for in our elderly in that regard, especially after a loss of a loved one.
Thank you very much. That was a very big response, but I think that we've touched on very many areas, and those areas are all reasons that we need to look for when we see that persons are disengaged. We have another question in the back right corner, and then we have one here, and then Mrs. Soto.
Well, this is more of a comment than it is a question. And I think one of the things that you'll find, speaking from an insurer's perspective, is that one of the challenges that we've come across, and I think it's something one of the panelists actually spoke to earlier, is that insurance generally expires when you are no longer a part of the working population. Unless you own the company that you're working for, what you'll find is that generally your insurance is attached to your employment. So I know that we've been in discussions with various government bodies of the Ministry of Health. The HSA has been involved in discussion around what our solutions are going to be for nationally for the care for the elderly and the way that we cover the cost of the health care. And one of the biggest challenges that I think that we've already found in the discussions has been the division between what is a health care cost that insurance is designed to cover and what is a social cost, and how difficult it becomes to actually draw the line between those two things the older we get. So for instance, not only does an older person need nursing and medical care, and some of them really don't for a very long time. My grandmother's 90 years old and she goes to the doctor once a year. But you look at the care that they're going to need on a daily basis in order to function, that is not necessarily medical care, that becomes a very, very big distinction and difference. And you may have some comments to add to that because of your experience in the field.
Thank you very much, Aniki. Yeah, that is definitely something that as a country we need to be focused on because those insurance benefits do expire and then that becomes an issue.
Good afternoon, everyone. I think I want to share something as opposed to asking a question. I recently came back from China this week, and one observation I had, which for me was really striking and encouraging, and I was really happy to see that, for the elderly population, China has parks, different types of parks, all over the country, where the elderly population gather to either socialize or to exercise. One of the parks I came across was actually an exercise park where they have all sorts of different bars and exercise equipment that were not minimal, that's something that, excuse me, I have the cold, so something that they could manage. And the elderly was out there actually exercising as well as socializing with each other. So it was providing physical benefits in addition to the mental benefits of being together and communicating together in an area. There was one guy who we were watching from the distance who was actually on a bar, exercise equipment, holding on and doing that swing where you're swinging your body all over. He was over 70 years old, and I was so amazed. I couldn't believe it. I went up the Great Wall of China. There was this elderly lady who was going up the steps, and I was panting away going up because I had the flu. I was fighting the flu, so I was struggling to go up those stairs. This lady walked past me. She had osteoporosis because, you know, she was walking, bending over, but she was holding on to the bar and climbing up those stairs. I got up to the first tower and gave up, said, no, I'm not doing this anymore. I'm going back down. This elderly lady kept going to the next tower. I could not believe it. But that is the culture that is set for the elderly population. They are encouraged to continue to be active, to remain active, and to stay healthy. There were other areas where we came across them where they were either communing together, doing embroidery work, or they were playing cards, or they were playing dominoes. There were always some park. Every city that I went to, or every area I went to, there was some park or the other for the elderly where they were all gathered. So I think that not only as an individual family member, you know, taking responsibility and being involved in your elderly family members' care, but as a society, if we change the culture, where as a society, as a government, we're also putting in place infrastructure where the elderly can benefit instead of having them locked up in the house where they become depressed, have no one to talk to because everybody's busy working and don't have the time to go and sit with them. If we have these facilities where they can get out the house and gather and socialize with each other until family members come home, then I think that will be great benefit to, you know, helping their mental health as well as their physical health. I just wanted to share that.
Thank you very much for that. I think before Mrs. Soto speaks, I just want to go back a little bit and pick up on a point that Aniki was actually alluding to. The fact that there are many persons in the community who do not have health insurance, the government actually has a program in place to assist those persons. So if you know of an elderly person, an older person, who does not have the means to pay for health care, they can go to the needs assessment unit and they can go through an assessment process in order to access funds that the government does put aside for those persons who do not have the means to pay for their own health care. The worst thing is to have an older person at home suffering, because many of the older persons are actually very proud and they don't want to admit that they need help. But if you know that that is the case, we can get them assistance from the government programs. And at the HSA, we do have a medical social worker who will assist persons with that paperwork, because oftentimes, you know, it's very difficult for them to fill out the forms and whatnot, and they will work with the individual or their family members in order to be able to get the documentations that's necessary in order to go through that assessment process at the needs assessment unit, and then they will be able to access the assistance. Yes, and that's the same process, yeah. Now, sorry to keep you waiting, Mrs. Soto.
I'm sorry. I'm not elderly, even though it's been a while since I've seen 65. But I'm not elderly. And Dr. Shillingford, you can be quiet up there. Pastor Allison, I totally agree with you. The gym is a wonderful place, and sometimes you have to pray in the morning when you get up to say, God, help me get to the gym. You go to the gym, and it is an amazing thing. I go 3 times a week. Thank you. I also try and swim 20 laps, but I'm here I have something to do with the Cayman Heart Fund, and recently we had exercise at any age. And I'm telling everyone in this room, while you're not even 65, get up and I don't care if you can't walk too good. You can sit in a chair and exercise every muscle in your body. And when I first came here in 1963, I had a class, and I had them come, and they exercised in a chair. They didn't believe it. And some of the women were so bloody sore, they didn't come back. Anyway, so I wanted to tell you we had a 60-year-old. Lizette can confirm this. We had a 60-year-old man who does clean eating. He's Caymanian, and he performed for us to the ladies' excitement. But he did. He is number 6 in the world of bodybuilding, and he's always had clean eating. He was a policeman. He is a trainer now at the gym, but he's always been a trainer. And he was the epitome. He is now going to the contest again, even though he came in number 6 in the world. He went, and he didn't enter into his age group, which was in the 60s. He thought, I'm looking at these 25-year-olds, and he entered into the 25 and up group. And I said, well, why would you do that? Because you were headed for, winning in the older group. And he said, oh, I looked at them. And he came number 6 in the world of drug-free bodybuilding. Wow. So I want to thank you for mentioning that, because they need to get up and exercise. Swimming. We have God's greatest gift around us in the sea. If I can't easily get in the sea, I had an 88-year-old friend have to drag me out the other day, so I don't really go there. I get in the pool, I can climb up and down. So get in the water, for heaven's sakes, get in the water. Nutrition is very important. I happen to be a chocoholic, and I just have to try and avoid it, but, something else. The mental outlook is so important, and you need to challenge yourself. The older people need to challenge themselves, and just because they're 80 doesn't mean they're elderly. So I think that word should be abolished. I think another important thing I wanted, the technology. It is harder for a lot of older people, the technology. But I'm going to say this here. We've got 3 hospitals, and they need to share the information they have got. Mm-hmm. When you take a test at one hospital, it should be shared with all 3. Yeah. They are not cooperating. Sorry, they need to be cooperating with one another. If I get a test done at one, I try and send it to one, and they say, well, we don't put that in our records. But we need the cooperation of the IT. The IT is becoming so important that and you all need to be responsible for your own IT. Get your reports and make sure you have a file of your reports of your latest blood tests and so forth and so on. And so one more thing, the red tape for the seniors, the red tape for everybody needs to be cut out. Forgive me for mentioning this. But for instance, referrals. They used to be able to go to a doctor like Dr. Schillingford, get a referral, and then you could maybe fax it or email it into the referral office. They've stopped that. Now you've got to go get in the car or find a car or find somebody for older people to get somebody to take you down to the hospital, to go up the stairs or the elevator, and then give it to them and wait. And it's hard on some of the older people. Older people can't get out, but maybe they could get somebody to email it in, and that should be put back into effect. And I think I'm done. God bless you all.
Thank you very much, Mrs. Soto. There is an information desk at the HSA now there where you can drop off those forms, and they will gladly take it upstairs for you. So that's some assistance for you anyway. But we will definitely take that on board. Mrs. Lucille Seymour.
Thank you very much, Mr. Lizette, and thank you to the esteemed panel. I listened with a lot of interest. But I want to say first, Mr. Lizette, thank you very much for putting the older persons parking at the hospital. I happen to have had to go to the doctor yesterday, and I looked at the sign, and for a moment, I wondered whether I was or not, but I decided I was, so I parked in. But this is more of a comment. In 2017, the government passed the Older Persons Law, which means that older persons do have a voice in the Cayman Islands. I happen to be the chair of that council, and the deputy is Mrs. Alice Mayco. And there's an ambitious action plan, goes forward to 1925, sorry, where am I? And what I would say to persons here, that, as Margaret Thatcher once said, you can tell the health of a country the way it looks after its children and its older persons. I would ask you to get a hold of the law, look at it, try to be part of it, because it is advancing the well-being of older persons. I didn't know that I would grow to be old, but I'm glad I'm here. And I now can appreciate my mother for when she was old. But when I was about 30, my sister, who is 10 years younger than me, looked at me and she said, "You know, you're old." Now she's 65. And I said to her the other day, "Are you old now?" She said, "Come on now, come on." But I want to remind people in the audience that the Cayman Islands is going to be known as an aging society. And it is very important that all of us make sure that we are part of the plans for this, for advancing our older persons. And lastly, what I'd like to say is that this is an intergenerational relationship that we have to have. Because we shouldn't wait until we are 75 or 85 to appreciate being old. We have to very early in our lives join hands with the young so that when they become our age, they don't suffer from some of the things that we're suffering from. Thank you.
Thank you very much, Mrs. Seymour. And again, we want to say a big thank you to the Older Persons Council. There are a number of people that serve on that council, and it's a very, very good action plan. And please, be informed and embrace that action plan in your workplace. Wherever you are, you can do something in order to be able to celebrate older persons and make it easier for them as they get older. I believe there's one more question.
The person on this platform that's being held, she's standing up and sitting down.
Thank you.
Hi, good evening. Again, not so much a question, but just a comment, and hopefully this will give you a little bit of food for thought. Just as you're planning, maybe if you can consider another vulnerable group as they age, and those are persons with disabilities. I work with persons with disabilities, and for those of us who do work with these individuals are always concerned as this population continues to age. And as I look around the room, I see some doctors and other professionals and even some family members of persons with disabilities. And there's always a concern, not only for these individuals who are so vulnerable in our society with their own health challenges, but also for their family members who are often the sole caregivers. The family members are aging, and the parents are often proud and will not relinquish or find it very difficult to relinquish some of the care to other family members, and it's very, very difficult. They have their own health challenges, and we see them aging as time goes by. So we just ask that you consider them as well, and how can we empower them? I'm no longer in healthcare directly, but we see the challenges that it presents for the families, for the extended care, or the other caregivers. It may be family members, it may be just friends, etc. There's also the issue of legal guardianship as they get older. I don't think capacity assessments are done on a regular basis, and so these individuals who care for persons with disabilities are not their legal guardians, they're next of kin, and so when issues arise, particularly medical issues, and someone has to make a decision for them, there becomes an issue. So can we plan and look at what we need to do and how we can empower these family members to not only take care of themselves as they get older, how can they prepare their disabled family members? Thank you.
Thank you very much. That is something that we really need to consider as well, and we need to help the parents or relatives of those individuals in order to be able to prepare for the aging of the individuals with disabilities. I think we have enough time for one final question.
Good evening. Sorry. I would like to support the lady that just spoke concerning the disabled. My wife and I, we have a daughter who is now 53 years of age. And she was physically disabled from birth. She actually she made her first step when she was 13 years of age. We had to teach her how to crawl. And it's becoming a real challenge for us, because as she gets older, she's becoming less able to manage herself. Even though she go out to work, she works at Ritz-Carlton Hotel. And she's been working at that establishment for, I think it's 12 or 13 years. And she worked at Hyatt for 18 years. But they were destroyed in 2004. And she had been, in September, and she would have been working 18 years in December. And she's very, very ambitious, and it's pretty hard for us to keep up with her, even though she's physically challenged. But my wife and I approached government, I guess about 10 years ago, or could have been more, about the same thing that lady just spoke about, building a facility for these individuals, because there are a number of these individuals in this island, especially in West Bay. And who will take care of these individuals when we are gone? And my wife and I often say, and some people say we're cruel, but we love our daughter. But we often say we would prefer for her to depart this life before we do. Because we want to make sure that she's well taken care of, and when we depart, we do not know what will happen to her. And I think it's high time for that matter to be taken into serious consideration to prepare a place for these individuals that they can have excellent care. I know a few years ago, we wanted to go on vacation, and we approached the Pines, and the fee was a bit too high for us to pay. So when we go on vacation, we have to take our daughter with us because we don't have anybody else to take care of her. This year, when my wife wants to travel because she loves to travel, and I say that when God created her, He made one mistake. He didn't give her wings, and she could fly. But I let her go on vacation, and I stay at home to take care of her daughter. So in order for her to have quality life, I take that responsibility quite seriously. So that is a matter that needs urgent attention, and I trust that the government will see fit to build a purpose-built facility for these individuals. Thank you.
Thank you very much, sir, for sharing that with us. And I'd like to salute you as a parent, actually. Obviously, you and your wife have done a tremendous job. The fact that you didn't give up on her, you worked with her to make sure that she had the skills in order to be able to go out and live a productive life. But I understand that there are still some concerns that you have about her growing older. And I'm going to ask Ms. Felicia Robinson if she would speak to that as far as the Department of Children and Family Services is concerned, if that's something that they would be able to assist you with.
I'm getting some instructions to the floor. At this point, we don't necessarily have beds allocated for respite for persons, but there are circumstances where we will bring in older persons or people with disabilities if needed, and care for them on an interim basis, as long as there is a bed available. We are trying to make provisions to address that, especially now for our younger children, because again, we recognize that we've got families out there who've got children and they're doing the caregiving. And as Linda said, who cares for the caregiver? And we recognize we've got to make some provisions for them. So with the new facility that's coming on board for our children, we have built into that respite bed allocation for families with younger children. At the moment, though, if you've got an older person, we can only accommodate them if there is a bed vacant. But we will take that into consideration and try to assist the family as much as possible.
Thank you very much, Ms. Felicia. We don't have those services available now, but, you know, as you mentioned, you need to have the peace of mind as you get older that, you know, should you die today, that she would be taken care of after you and your wife go on. So I think that's a discussion you need to start having with your social worker or with someone, because it's very important to you to have that peace of mind. And, you know, there needs to be a plan. We don't know what that plan is going to be because as a country, we don't have a plan. But I think for your individual peace of mind, that is a conversation that you need to start having.
If I can also just add that we now have a unit within the Department of Children and Family Services that's dedicated primarily to dealing with older persons matters. As an older person, sir, I'd like to invite you to come in and see one of the social workers so you can discuss your concerns as you plan for your life and see how they can assist you.
Absolutely. think you have a follow-up comment or question. The mic's right there.
Yes. Well, in regards to the social services, we anticipate that her daughter, because we only allow her to go to work three half days a week. I take her in the morning for 8 o'clock, work. Now she'll be ready for work from 3 o'clock in the morning. But we take her there for 8 o'clock. I go back and pick her up for 12:15. But at any time you can expect that the establishment will say, I'm sorry, but we can't keep you on employment anymore, which will be a disaster for us because she wants to work every day. But we're expecting her to be laid off, at any time. So we applied to, NAU for assistance because she gets a small salary. And we figured that, I'm retired. My wife was a homemaker all her life. I'm not on any government assistance, but thank God we had made plans for ourselves. But we figured our daughter will probably need it in the near future. And this October, this month, it's 12 months since we applied for that assistance and haven't heard a word from them. In fact, well, they called. They didn't call. I went back to find out what was going on. They said, well, you didn't apply for vouchers. I said, no, we applied for financial assistance. Well, you should have applied for vouchers, which would have been quicker. So I filled out a new application. And 2 or 3 days later, they called back and they gave them all the information they needed. Called back and said, and I'm sorry, but you have to give us the information on yourself. I say, for what? She's a 53-year-old individual. I shouldn't have to give my information. I gave you everything that I knew about her. And so far, we haven't heard any more. And so I'm hoping that Ms. Felicia could maybe look into it.
Yes.
The name of the child, or not the child, she's an adult.
I think you can see Ms. Felicia afterwards because
Yes.
the reason why they're asking your information is because you're the caretaker. But we can clarify that, and I can ask Ms. Felicia to make sure that she follows up so that you get a call back tomorrow to let you know what is.
No, tomorrow is Saturday.
I'm sorry.
But also,
Tomorrow's a work day
Lizette,
for
also
me.
to clarify, Lizette, that information would have to be passed on to the director of the Needs Assessment Unit. So
But we
I
can
can
make
act
sure
in
that we
that
do that.
capacity to do that.
Sure. Thank you all very much. Before we wrap up, I want to draw our attention to our Minister of Education, Mrs. Juliana O'Connor-Conley. We really appreciate you being here with us for the significant portion of the day. It's very, very important for our lawmakers. For our lawmakers to be here and hear about this information because they're also being empowered in regards to the needs that we have in our community. So I really, really appreciate you taking the time out to be with us today, Mrs. Juliana O'Connor-Conley. And lastly, I want you to join me in once again congratulating and thanking each member of our panel who have spent this 2 hours here this afternoon to share with you the knowledge that they have in order to make sure that you are empowered to be able to be a better caretaker, a better family member, or certainly a better older person to embrace your health while you have it. Thank you very much. And I just have a small token that is sponsored by Kirk Freeport for each one of our panelists. So again, thank you, and tomorrow morning starts at 9 o'clock. We have some very, very good presenters, so please don't miss out. Be here and be seated by 9 o'clock so we can have a very early start. Thank you.